Adults. Adulthood is the longest period of the life cycle. There is no clear beginning or end, and adulthood is determined biologically, socially, and culturally. For example, do you become an adult at 18 or 21? When does someone transition from being a middle-aged adult to being elderly? And I think another question is, how do different cultures define adulthood? Based on the needs for various nutrients, the Food and Nutrition Board divided the adult years into 4 stages: 90 to 30 years of age, 31 to 50 years of age, 51 to 70 years of age, and 70 years of age and older. The intervals encompassing ages 19 through 50 are often referred to as young adulthood, 51 to 70 as middle adulthood, and beyond 70 years of age as older adulthood. Unlike earlier stages of the life cycle, nutrients are used primarily to maintain the body rather than support physical growth. As adults get older, nutrient needs change. For example, vitamin D needs increase for older adults. During late adolescence and adulthood, the body's major task is to maintain cells. From the beginning of adulthood until age 30 or so, body systems are at their peak efficiency rate. Stature, stamina, strength, endurance, efficiency, and health are at their lifetime highs. After about age 30, the rate of cell breakdown slowly begins to exceed the rate of cell renewal, leading to a gradual decline in organ size and efficiency. Eventually, the body can't adjust to meet all physiological needs, and body functioning begins to decrease. Nutritional issues. The challenge of the adult years is to maintain the body, preserve its function, and avoid chronic disease, or at least delay it. A healthy diet can help achieve these goals, and the dietary guidelines for Americans and My Plate should be used to plan the diet. The 3 main nutrition goals are: balance calories with physical activity to manage weight, consume more fruits, vegetables, whole grains, fat-free and low dairy products, and seafood, and consume full foods with sodium, saturated fats, trans fats, cholesterol, added sugars, and refined grains. The diseases of overconsumption begin to manifest during middle adulthood. There is overconsumption of calories, total fat, saturated fats, cholesterol, sodium, sugar, and alcohol. The diseases of overconsumption are on the next slide. Atherosclerosis, heart disease, stroke, hypertension, obesity, type 2 diabetes, gallstones, cancer, especially colon, breast, uterus, prostate, ovary, and pancreas, dental caries, and cirrhosis of the liver. The diseases of underconsumption also begin to manifest during middle adulthood. The foods and food components that are associated with diseases of underconsumption are water, fiber, potassium, calcium, vitamin D, and iron. The diseases of underconsumption are on the next slide. Constipation, diverticular diseases, hemorrhoids, colon cancer, anemia, osteoporosis, hypertension. Please note that hypertension is both a disease of overconsumption, sodium, and underconsumption, potassium and calcium. Nutrient needs. Meeting nutrient needs can prevent, delay, or improve the management of certain diseases. The daily recommended intakes for adults are divided by gender into 4 age groups to reflect how nutrient needs change as adults grow older. Calories or energy. After age 30 or so, total calorie needs of physically inactive adults fall steadily throughout adulthood. This is caused by a gradual decline in basal metabolism. For the most part, adults can control the amount of physical activity that they get. Protein. Most Americans exceed the recommended levels of protein. Low-income adults, those with lactose intolerance, and those who have difficulty chewing meat may be at risk for low protein intake. Fat. The fat intake of adults is usually at or above the recommended amounts. Adults need The fat intake of adults is usually at or above the recommended amounts. Adults need to reduce their intake of total fat, saturated fats, and cholesterol to reduce their risk of obesity, heart disease, and certain cancers. Carbohydrates. Many adults need to shift the carbohydrate compositions of their diets to emphasize whole grains while minimizing refined grains and simple sugars. A diet high in complex carbohydrates and fiber helps to achieve nutrient and energy needs while decreasing the risk of colon cancer and heart disease. Calcium and vitamin D. Calcium and vitamin D tend to be low in the diets of all adults. Development of osteoporosis is affected by inadequate intake of calcium and vitamin D, reduced absorption of these nutrients, reduced synthesis of vitamin D by the skin, decreased ability of the kidneys to put vitamin D in its active form. Increasing age often causes a decrease in activity of the lactase enzyme, which leads to a decrease in absorption in milk and milk products. Calcium and vitamin D fortified foods from dairy and non-dairy sources should be emphasized. In addition, 10 to 15 minutes of sunlight per day can boost vitamin D status. Iron. Iron deficiency anemia is common in adult women due to inadequate dietary intake and iron loss through menstruation. And anemia in adults of all ages can also be caused by decline in stomach acid production, bleeding ulcers and hemorrhoids, and use of aspirins and other medications that causes bleeding of the GI tract. Many adults have a less than optimal dietary intake of zinc. Zinc absorption also declines as stomach acid production diminishes with age. Poor zinc status may contribute to the taste sensation losses, mental lethargy, and delayed wound healing that many older adults experience. In fact, many older adults tend to lose their sense of taste, and many times adding enough zinc back to the diet make those taste buds come alive again. Magnesium. Magnesium tends to be low in the diet of most adults. Inadequate intakes may contribute to bone loss and osteoporosis, muscular weakness, mental confusion or brain fog, sudden death from low heart rhythm, cardiovascular disease, and diabetes. And the best source of magnesium in the diet Magnesium tends to be low in the diet of most adults. Inadequate intakes may contribute to bone loss and osteoporosis, muscular weakness, mental confusion or brain fog, sudden death from low heart rhythm, cardiovascular disease, diabetes. The best source of magnesium is through diet, since supplements can cause loose stools and diarrhea. Folate, vitamins B6 and B12. Folate and vitamins B6 and B12 are required to clear homocysteine from the bloodstream. Elevated blood levels of homocysteine, a non-protein amino acid, increases the risk of cardiovascular disease, stroke, bone fracture, and neurological decline that is often seen in some elderly. Aging is also associated with a decreased stomach production of vitamin B12, an intrinsic factor, which can lead to pernicious anemia. Adults age 51 years and older need to meet vitamin B12 needs with supplements or fortified foods. Vitamin E. Most adults have low intakes of vitamin E. Vitamin E is an antioxidant, and low intakes may increase damage to cells from free radicals, speed aging, and lead to physical decline. Carotenoids. Adequate dietary intakes of certain carotenoids, such as lutein and zeaxanthin, may reduce the risk for cataracts and age-related macular degeneration. Diets high in yellow and orange fruits and vegetables, as well as green leafy vegetables, are excellent sources of carotenoids. Other issues. Weight changes. 5 years after reaching adult height, maximal strength, endurance, and flexibility is reached. And many individuals begin to gain weight in their 20s and 30s and find it difficult to lose these extra pounds. Muscle mass begins to decline after the third decade, and basal metabolic rate, or BMR, decreases about 2% every 10 years from age 30. Muscle mass declines with aging as some muscle cells shrink or die, and the loss of muscle mass leads to a decrease in muscular strength and basal metabolism. The aging body typically loses lean tissue and gains adipose or fat tissue. Increased body fat results from overeating and lack of physical activity. But even physically active adults usually gain some central body fat after they are age 50. And the central body fat is a nice way of saying that gut fat, the spare tire around the midsection. The extra body fat in the mid region, that's central body fat, increases the risk of type 2 diabetes, hypertension, cardiovascular disease, and osteoporosis. Oral health. Periodontal disease or gum disease is the main cause of tooth loss in adults. Adults with poor dental health may have difficulty chewing meats and fruits and vegetables. Early detection of periodontal disease reduces the risk of permanent damage to teeth and gums and can prevent more extensive and costly treatment in later years. Oral cancers are most common in older adults, particularly those over 55 years who smoke and are heavy drinkers. Adults with oral cancers have difficulty eating and chewing, which further aggravates Oral cancers are most common in older adults, particularly those over 55 years who smoke and are heavy drinkers. Adults with oral cancers have difficulty chewing and eating, which further aggravate Oral cancers are most common in older adults, particularly those over 55 years who smoke and are heavy drinkers. Adults with oral cancers have difficulty eating and chewing, which further aggravates the treatment and healing process. Now, in adulthood, nutritional issues also vary by sex. Women's nutritional issues. Some of the common health and nutritional issues for women are heart disease, breast cancer, excessive dieting, eating disorders, obesity, and osteoporosis. Whereas some of the common health and nutritional issues for men are heart disease, prostate cancer, obesity, high alcohol consumption, high protein intake, high consumption of sodas and sports drink, and poor food safety habits.